you as a parent can make the wise decision and suggest the doctor to use glue or tissue adhesives instead of the typical sutures. Before we go into the process of how the two different wound closure techniques works, we're going to discuss a little bit about how a wound closes. Now, you don't need super scientific background knowledge for this, but just the basis is that when you get a wound or when you tear something or something rips open, you tear layers of tissue and blood vessels and stuff like that. Dirt and bacteria can get in the wound, and different types of cells will come in, irrigate it, clean it out, and whatnot. During this process, it usually takes about 7 to 10 days, and different cells will come in, clean out the dead bacteria, the dead cells. Other cells will come in and regrow the tissue using like collagen or fibrin and stuff like that. Not super important for you to know, but just the basis of wound healing is that you clean the area out and then you keep it in an environment where the edges are closed, and then the tissue can come in and the tissues and cells can come in and heal themselves. And grow and close the wound naturally and develop a scar and stuff like that. So wound closure techniques, whether it's stitches or tissue adhesives, help bring the edges together so that the wound can stay clean and it can continue to heal naturally. Next, we're going to talk about how you apply the two different things. With tissue adhesives, it is like a glue. You're going to hold the edges together. A doctor or a nurse. What's nice about tissue adhesives is that nurses are even able to apply the glue to the wound and can close it, and that saves more time for the doctor and stuff like that. But you pinch the wound closed, and then you use the applicator and you put the glue on, you hold it together closed for about 5 to 10 minutes, and that's it. The wound is covered with basically a waterproof bandage, and then once the wound is healed, the tissue adhesive or glue will just fall off, and then you have a scar. Sutures, on the other hand, are a little bit more complicated and can freak children out quite a bit. With suturing, you have to use an actual needle that pushes thread in and out of the wound to bring it together with various knots and stuff to keep it closed. Before you even start with the sutures, though, you have to administer a local anesthetic in the form of usually a really large needle is inserted into the wound, and the local anesthetic is pushed into the area, floods the area, numbs it so that the child cannot feel anything. Although the child cannot feel anything once the local anesthetic is administered, it is a very painful process, and once again, large needles towards the face can be very discomforting to children, and so applying sutures is a little bit more complicated. Next, I'm going to go through the many different ways that tissue adhesive or glue is better than stitches. The first being that the type of wound is very important. Tissue adhesives can only be used in very specific wounds, specifically those that are short and linear and in low tension areas. Well, what does low tension mean? Low tension means that it's not on a joint, it's not somewhere where there's a lot of movement, a lot of stretching, stuff like that. So usually low tension places are going to be your chin, above your eyes, and your forehead and your cheeks. High tension is going to be kind of your nose because you have to go across the nose, and then anything kind of towards your lips. So if it is in a high tension area, you can use tissue adhesive, but sometimes you have to apply multiple layers, and sutures sometimes can be a little bit better for that because the stitches themselves are a little bit stronger than the glue. Also, on the other hand, stitches are better in wounds that are near hair, so the back of the head, near the hairline, anything like that. Stitches will be better for that type of wound. Also, if the wound is infected, or if the wound comes from an animal bite or has severely jagged edges from a traumatic experience by being ripped open from something, if the edges aren't being able to be met close together in a nice linear way, then sutures are going to be a little bit better for that. But if it's kind of your typical wound, for children, the most common reason for why they visit the emergency department or urgent care is because they split their chin open, they split their eyebrow open up above here, or their cheek open, stuff like that. That is all really good for tissue adhesives to use. So next, we're going to talk about pain. Multiple studies have asked both parents and children to report on a 1 to 10 scale of how their pain is, with 1 being they don't feel anything at all, and 10 being the worst pain imaginable. Most of the pain arrived at about, I think it was about the 3 to 4 mark with the sutures, and about the 2 to 3 mark with the tissue adhesive, because there's no needles involved, there's not the added risk of administering the local anesthetic, and anything like that. There's no tugging, no pulling, anything like that that can come from sutures, and so tissue adhesives are a little bit less painful to apply than sutures. Next, we're going to talk about distress of the patient. As parents, you probably know that when children experience unfamiliar things, they tend to freak out. They wiggle, they scream, they cry, they don't know how to express their emotions very well, so when they're in shock because they got hurt, it can be a really hard time to calm them down. Like in my example, when I cut open my chin, it was really hard for the doctor to get me to sit still, and it was nearly impossible for him to be able to effectively suture and stitch my chin shut without severely restraining me, and sometimes they can even use a sedative to put the child out to close it. Because with tissue adhesives, there are no needles coming towards their face, no, whether it's like the actual syringe needle or the needle attached to the thread, usually children are able to calm down a lot more, and they can be, they're a lot less willing to fight and stuff like that with the tissue adhesive. So it's a lot less anxiety inducing for both the patient, the doctor, and the parent when tissue adhesives are used to close pediatric facial wounds. Next, we're going to talk about time. So stitches take a lot of time to do because you have to be able to evenly space them out. There are intricate knots involved. There are intricate ways to make sure that the way you stitch is not going to leave marks, that it's going to provide a proper scar. With tissue adhesives, it is like glue. All you have to do is pinch the wound together. You kind of draw a couple lines across, usually use a couple layers, and then all of a sudden you're done. A study showed that stitches require about 4 times the amount of time for the doctors to complete the procedure than if tissue adhesive was used. This is important because everybody is really busy, and usually accidents happen at the most inconvenient moments. Nobody wants to spend all day at the hospital or at the urgent care office, and if there is a faster, quicker, more painless way to do it, then I would think that most people would want to do it that way. So it requires a lot less time for the doctor or the nurse to perform the procedure if they use tissue adhesive rather than if they use glue. Next, we're going to talk about cost. Everybody likes to save money. Parents with children, they're usually always trying to think of ways to save money, and usually accidents happen, so when they have to go to the emergency room, it is a unplanned for cost that can put a real dent in the budget and the savings and stuff like that. So you would want to use something, a procedure, that would cost less money. Even though insurances pay for a lot of the procedure and stuff like that, there is still an overhead cost that the patient does have to pay for, and if you compare sutures versus tissue adhesive, you only have to pay for the glue, while when you do suturing, you have to pay for the local anesthetic. There's additional bandages involved. You need a suture kit with the needles and the thread and all of that stuff, and it is usually about about $5 less to do tissue adhesive than to do sutures. So as a parent who wants to save money and it is a unplanned accident, it can be real stressful. You would want to pick the procedure that also saves you money. Next, we are going to talk about complication rate. So whenever you have a wound, you open that wound, the inside of your body, to the outside area where it is not used to things coming into contact with that inside area. So bugs, bacteria, germs, dirt, all sorts of little growing organisms can get into the wound and can cause it to become infected. Pus can form, the wound can reopen, stuff like that. So complications are not good. There's also a word called dehiscence, and that means when the wound reopens. So you can close it using sutures, or tissue adhesives, and then after sometimes it may have a chance of reopening or having dehiscence. With the studies that I looked at in preparing for this presentation, I have come to the conclusion that both sutures and tissue adhesives have the same complication rate, meaning you both have a very small chance of getting a complication, whether it's infection or having the wound reopening, if you use tissues or if you use sutures. So there's no one way to completely 100% prevent infection or complications from happening, but in either case, you can use tissue adhesives or sutures, and your chances of having complications will be really low. Next, we're going to talk about the cosmetic outcome. Children are really young, their skin is really elastic, and it's growing a lot. Parents can be very concerned about the scars that are on their face. Bad, unflattering scars can affect children when they're in school, because kids are very blunt and honest, and they can poke fun at it. It's different. They'll always comment on it. They can make the child who has the unflattering scar be really uncomfortable, self-conscious about themselves. We have a tendency to judge right off the bat, and if we see somebody with a weird scar on their face, we have a tendency to be afraid of them or just kind of be more on edge around them. And so when parents come into the hospital rooms or urgent care with children with facial wounds, their main concern is, I want the scar to be as small as possible. Once again, just like the complication rate, all the studies have shown that it is statistically insignificant whether or not you use sutures or tissue adhesives. Both will produce a very satisfactory outcome. These studies were where after about 6 months, plastic surgeons would look at the scar and then rate it on a scale, and all of the differences were so small that it was deemed statistically insignificant if you chose sutures or if you chose tissue adhesives. The cosmetic outcome would be the same, and you would have a small, insignificant scar. Lastly, we're going to talk about aftercare. Once again, I've mentioned this a couple times. Children are unpredictable. They are emotional. They don't like to sit still. They like to get into things. So when you have to take care of a wound or you have to take care of something, you want the parents to be able to take care of it easily and to try and prevent the least amount of risk of the child messing with the wound and causing complications. Sutures usually require a second follow-up appointment, which of course adds on to the time and the cost of the parent. They have to pay to see the doctor again to remove the sutures. They have to take time out of their busy schedule to remove the sutures. It can also cause pain to remove the sutures because once again you have to apply local anesthetic to remove the sutures. So sutures in this case, their aftercare is a little bit more complicated. You also have to keep a sterile dressing on it. You have to make sure it doesn't get wet. You can't shower or get the area wet until after the stitches are removed. And that can be a little bit more complicated for parents with little children. Tissue adhesive, on the other hand, forms a waterproof barrier, so the child is allowed to get the area wet. The child is allowed to take a shower, unbathe, anything like that, and the wound will stay clean. There is also no secondary appointment needed to remove the tissue adhesive. As stated earlier, after about 7 to 10 days, the glue will just fall off and the scar will remain. That is all there is to remove it. You don't have to add any antibiotic ointment. You don't have to add any bandages, anything like that. You just have to let it sit, and then after a certain amount of time, once the wound is healed, it will fall off. So in terms of aftercare management for the parent, it is a little bit easier and less stressful if the child's wound was closed with the glue or tissue adhesive.